Hello, Dr. Boel. This is Stuart, and this is my son Weston. Say hi.
Hi.
Hi. And we're going to try and do the gastrointestinal abdominal exam today, and hopefully this works out. So, first thing I would do is wash my hands, and then I'm going to explain to Weston what a PA is. Do you know what a PA is? Physician's assistant?
Doctor helper.
Okay, that's good enough. And then I'm going to explain the exam to him. So today we're going to inspect your belly. I'm going to listen to it with my scope. I'm going to palpate it and just feel it. Say, excuse you.
Excuse me.
I'm going to feel it a little bit and just make sure that everything's normal in your belly, okay? You can lay down now and calm down. So, I'm going to perform the exam, first doing an inspection, and then I'll listen to the belly, then we'll percuss it and palpate it, and then finally there'll be some special tests. So the first thing I want to do is I just want to inspect the belly for color, shape, symmetry, and I want to make sure there's no scars or bulging or any pulsations going on. So I'm going to just have him breathe normally. I'm going to breathe normally. I'm just going to inspect the belly from all sides. I'm going to make sure that there's no pulsations and everything looks good. Okay? So I want him to take a deep breath and hold it, and then blow it out. And then I want him to make his belly big and inspect it that way also to make sure there's nothing going on there. Okay, good. So now we're going to listen to the four bowel sounds in the bowel sounds in the four quadrants, and then I'm also going to listen for the aorta and midline. I'm going to listen renally. I'm going to listen for iliac bruit, and I'm also going to listen for femoral bruit. So first we'll just do the four quadrants with the bell here. Just breathe normal. And I'm going to listen for the aorta here, midline. And then the renal areas for renal bruits. I'm going to listen for iliac bruits. And finally, femoral. Okay, that sounds good. The next thing I'm going to do is I'm going to percuss all four quadrants of the abdomen. I'm also going to percuss the gastric bubble, the liver, the spleen, and the right and left flanks. So starting with the four quadrants of the abdomen. I'm going to percuss that. Okay. And then I'm going to try and percuss the liver and find the edge of the liver heading up. And then we'll do the spleen. Start down here, work our way up towards the right rib cage. You're right. And then I'm going to percuss the sides, both flanks. Also, trying to percuss the gastric bubble bottom of the rib cage at the top of the diaphragm. Okay. And finally, I'm going to palpate all 4 quadrants of the abdomen. I'm also going to palpate the aorta for size. I'm going to palpate the edge of the liver and the spleen. And I'm going to try and palpate the kidneys also, but one at a time. So first, I'm just going to lightly palpate over her stomach with one hand and feel for any abnormalities or anything that's hard. I'm going to go midline. Any pain there?
No.
No? Okay. Then we're going to deeply palpate the area. I'm going to press down. You relax your belly. Relax your muscles so it can really feel down in. Okay. Now, in order to palpate the liver, and this also goes along with Murphy's sign, I'm going to ask him to take a deep breath in. And then as he exhales, I'm going to push in. And as he tries to inhale again, if he has pain or guarding, that's a positive Murphy sign, but that's also how we're going to palpate the edge of the liver. So I want you to take a deep breath in and blow it out. And then take another deep breath in. Any pain there?
No.
Okay. To palpate the spleen, I'm going to put my hand on his side here and try and like pull in while I palpate up. Also while he's doing some deep breaths. And I'm not really going to feel the spleen unless it's enlarged. But this is how you would feel it. The kidneys, also like the spleen, we're going to be trying to palpate on both sides down in the gutter, that they call it. And just let him breathe normal and try not to laugh. Okay. Good. So finally, I showed you Murphy's sign, but we're going to show a few other tests that have to do with some appendix inflammation tests you can do. The first one's the obturator sign. We're going to bring the leg up to 90 degrees. And what I'm going to do is I'm going to rotate the thigh out while pressing in on the knee. And if he has pain in his appendix area, this will cause him to say, ouch. Any pain?
Nope.
No.
Don't shake the table.
Okay. The next one is the psoas sign, so I need you to turn on your side. Leg straight, please. And I'm going to push in on his hip while bringing his leg back. And again, this would cause pain in his appendix area.
Nope.
That's a psoas sign. We showed the Murphy sign already. The next appendix sign we're going to talk about is the McBurney sign. And basically that's just, we're going to just push down on the stomach between the belly button and the hip asis, and we're going to pick a point right in between there where the appendix would be and push on that, and that would cause pain if we had an appendicitis in the patient. That's the McBurney sign. Another appendix sign is the roving sign, where we're going to palpate the left lower quadrant, and if he had a problem with an inflamed appendix, that would cause pain in his right lower quadrant. So that is the roving sign. There's two signs we're looking for pancreatitis. That's the Cullen sign, which would be a discoloration, almost like a black and blue, yellowish discoloration around the belly button. That's a positive Cullen sign test. And then the gray Turner sign would be the same discolorization that would be on the left flank back in the kidney area. The final appendix test that we would talk about is the Markle sign, which is called a heel drop or a heel jar pain. So if he was up on his toes and he would drop to his heels, that would cause pain in the right lower quadrant. You can also just maybe bump the table, and as he would have to steady himself with his abdomen, that would cause right lower quadrant pain. You can also jar the foot, jar the heel, and that would also send the pain up to that quadrant. So that is our abdominal review. Sorry if it wasn't very good or hard to watch. Hopefully we'll get better at it by the end of the semester. But thank you, and we'll see you later.
See you. Bye.
Bye.